Hello everyone, it's Dr. Nirav Pandya. A lot of 49ers fans have questions about the Achilles tendonitis that Christian McCaffrey is dealing with. Here's a quick breakdown of this injury and what some of the treatment principles are. Now, at a very basic level, it's important to understand that a tendon is a structure that connects muscle to bone. This area is very susceptible to injury in athletes, either acutely through a rupture or through more chronic issues such as tendonitis. Now, what exactly is tendonitis? Tendonitis is inflammation in that tendon, which causes pain and swelling in that area. So if you look at this model of the foot, basically when you have Achilles tendonitis, what ends up happening is that where the tendon attaches down here, you'll basically get inflammation around that area, which will cause pain, which can cause decreased mobility and make things like running and jumping very difficult to do. Now, what you want to avoid when you have a tendonitis is prevent it from becoming a tendinosis, which is more chronic changes in the tendon where the tendon degenerates. Now, some people may ask, does a calf injury have a connection to Achilles tendonitis? Now, it's not that case in every athlete, but if you think about it from an anatomical standpoint, there are two main calf muscles, the gastrocnemius and the soleus muscles. Those muscles basically transition into the tendon. So theoretically, if you do have a calf injury, you will potentially then place more strain on that tendon, which can lead to tendonitis. Now, in terms of treatment principles, people ask, how can you actually get rid of Achilles tendonitis? Now, the number one thing to understand is that most cases of Achilles tendonitis come from overuse. So the number one thing is to decrease that load. In addition, things you want to do to help get rid of the inflammation and pain is things such as physical therapy, icing, but at the same time maintaining mobility and strength. Because the Achilles tendon is connected to those calf muscles, what you don't want is that by resting that area, you then get weakness up in the calf area, which can then lead to other types of injuries. In addition, because the Achilles tendon is very important in terms of running, jumping, and cutting, it's also important to note that other areas of the body can potentially get injured as well too. So it's important to make sure that you're treating that area so you don't get secondary compensatory injuries. Now, the hard thing to know is how bad is actually everyone's case of Achilles tendonitis. It can vary from individual to individual. The degree of pain, swelling, and if there's any degeneration starting to develop in that tendon can make this injury sometimes last longer or shorter. Now, for many athletes, this may just simply be a short period of time in which they're having discomfort and they can get back to play. But the key thing to understand is that you don't want that inflammation to progress to something that becomes more chronic or could lead to a rupture of the tendon itself. Thank you.